Human bipedalism was an important evolutionary adaptation allowing for faster, more efficient movement. A vital component allowing us to walk upright is the anatomical structure of our legs and feet. The leg is found between the knee joint and the ankle joint. It contains two long bones, the large central tibia that bears most of the body's weight, and the smaller fibula that sits laterally to the tibia. Inferior to the leg is the foot, which consists of 26 individual bones. These include the tarsals, metatarsals, and the phalanges. This video will feature two tarsal bones, the talus and the calcaneus, which is also known as the heel bone. The main joint of the leg and foot is the ankle joint. This modified synovial hinge joint is formed by the talus, fitting snugly into the bracket formed by the tibia and the fibula. The ankle allows the dorsal side of the foot to move towards or away from the anterior surface of the leg, and these two movements are respectively defined as dorsiflexion and plantar flexion.
The muscles of the leg allow movement of the ankle joint and some movement in the feet, as well as playing an important role in postural stability. An effective way to examine the muscles of the leg is to divide them into three compartments: the posterior, the anterior, and the lateral compartment. The most superficial muscle of the posterior compartment is the gastrocnemius, that crosses the knee proximally to attach to the femur, allowing flexion of the knee. Distally, gastrocnemius crosses the ankle to attach to the calcaneus via the Achilles tendon, allowing plantar flexion of the foot. Deep to the gastrocnemius is soleus, a large muscle important for standing posture. Soleus also attaches to the calcaneus via the Achilles tendon to allow plantar flexion. Alongside the soleus is the plantaris muscle, a small, relatively unimportant muscle analogous to the palmaris longus in the forearm. Deeper in the posterior compartment is tibialis posterior, originating from between the tibia and fibula. The tendon of tibialis posterior crosses the ankle medially to allow plantar flexion and inversion of the foot. Flexor hallucis longus runs laterally to tibialis posterior, and its tendon crosses the ankle and runs along the bottom of the foot to attach to the distal phalanx of the big toe. This allows it to perform both plantar flexion of the ankle and flexion of the big toe. Flexor digitorum longus is equivalent to flexor hallucis longus, but runs medial to tibialis posterior, and instead attaches to and flexes the other four toes. The anterior compartment contains three muscles. Tibialis anterior can be found on the anterior aspect of the tibia, running down and attaching to the tarsal bones on the medial side of the foot, allowing for inversion and dorsiflexion of the foot. Extensor hallucis longus and extensor digitorum longus are effectively anterior analogues of flexor hallucis longus and flexor digitorum longus. These muscles cross the anterior aspect of the ankle, allowing dorsiflexion, and then run along the top of the foot to attach to the distal phalanxes, allowing extension of the toes. Lastly, the lateral compartment contains only two muscles, peroneus longus and peroneus brevis. Both muscles originate from the fibula, with the peroneus longus the slightly longer, more lateral of the two. Both have tendons that cross the ankle laterally, where they then diverge, with the tendon of peroneus longus going across the bottom of the foot to attach to the first metatarsal, and the tendon of peroneus brevis travelling a shorter path along the calcaneus and attaching to the fifth metatarsal. As they both cross the ankle laterally, both peroneus muscles are the main muscles for eversion of the foot.
In order for these muscles to elicit voluntary movement, they need to be innervated. As the sciatic nerve passes the popliteal fossa, it diverges into the tibial nerve and the common peroneal nerve. The tibial nerve runs down the leg, innervating all the muscles of the posterior compartment before continuing into the foot. The common peroneal nerve splits into two more nerves, the superficial peroneal nerve and the deep peroneal nerve. The superficial peroneal nerve travels down the leg towards the lateral side, innervating both muscles of the lateral compartment, whereas the deep peroneal nerve continues down the leg to innervate the three muscles of the anterior compartment.
The muscles of the leg are also supplied with blood flow via the vascular system. As the popliteal artery passes the popliteal fossa behind the knee, it diverges into the two main arteries of the leg, the anterior and the posterior tibial arteries. The anterior tibial artery supplies the muscles of the anterior compartment before continuing into the foot. The posterior tibial artery supplies the tibialis posterior and flexor digitorum longus before continuing into the foot. Importantly, the posterior tibial artery also gives rise to a lateral branch in the leg called the peroneal artery, which supplies the flexor hallucis longus, as well as both peroneus longus and peroneus brevis. These arteries all have deep accompanying veins that share the same name. And finally, in terms of superficial veins, there are the small and the grey saphenous veins that run up the leg on the lateral and medial side respectively.
Thank you for watching this short video. We hope that you are now more familiar with the muscles and bones of the leg and how they contribute to the movement of the foot and the ankle joint.